Subscribe now for easy-to-understand health tips. Dr. Madam.
Suddenly, when you coughed, you noticed a reddish color in your sputum. In an instant, your heart skipped a beat with fear and anxiety. 1,000 questions started swirling in your mind all at once. Is this something very serious? Coughing up blood is a symptom that never lets anyone feel at ease. Whether it's a small amount or a lot, it should never be taken lightly. Today, we will calmly and step-by-step understand why coughing up blood, medically known as haemoptysis, actually happens and what your body is trying to tell you. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS and other reliable medical sources. Before we begin, please subscribe to this channel to get more simple, science-based, doctor-reviewed health videos like this. What does it actually mean to cough up blood? Coughing up blood means that the blood is coming from inside the lungs or airways. This is not blood from vomiting, nor is it from a wound in the nose or mouth. Sometimes there may be a few drops of blood mixed with saliva, sometimes blood repeatedly mixed with phlegm. The amount is important, but even more important is the underlying cause. Understanding the structure of the lungs and airways in a simple way. When we breathe in, air enters through the nose, passes through the throat and reaches the lungs via the windpipe or trachea. This trachea splits into two branches, going to the right and left lungs. Then, like the branches of a tree, it divides into smaller and smaller branches. At the very end are the tiny air sacs called alveoli, where oxygen enters the blood and carbon dioxide is expelled. These parts are very delicate and filled with blood vessels. Therefore, infection, inflammation or injury can cause bleeding from here. Common causes related to infection. Imagine you've had fever, cough and body aches for several days. Suddenly, one day you notice a little blood with your cough. Infections like bronchitis or pneumonia are the most common causes of coughing up blood. During an infection, the lining inside the airways becomes swollen. It softens, and if you cough forcefully, small blood vessels can burst. Although it can be alarming, the good news is that once the infection clears up, the bleeding usually stops as well. When can the situation become serious? Now imagine another scenario. There is no fever, no cold, yet if blood repeatedly appears with coughing, doctors become very cautious in such cases. Blood in the cough can also be an early sign of lung cancer, especially if the person is older or has a history of smoking. Often, blood appears even before any other symptoms show up. This does not mean that blood always indicates cancer, but it does mean that getting tested is extremely important. Chronic lung disease. Some people cough up a lot of phlegm every day for years, and gradually their airways become abnormally widened. This condition is called bronchiectasis. These airways are easily infected and sometimes bleeding occurs. Most of the time it's a small amount of blood, but occasionally a large amount of blood can come up suddenly. Sudden life-threatening causes. Sudden severe chest pain, extreme difficulty breathing, then blood with the cough. This could be pulmonary embolism, meaning a blood clot in the lungs. This is a life-threatening condition and requires immediate medical attention. In severe heart failure, you may also have frothy, blood-tinged sputum. Rare but important diseases. In some very rare diseases, the body's immune system attacks the lung tissue. In this condition, along with coughing up blood, there are other symptoms as well, such as severe weakness, joint pain and kidney problems. When no cause can be identified. Sometimes, even after conducting all tests, no specific cause can be found. This is called idiopathic haemoptysis. Possibly, a very small blood vessel bursts, similar to a nosebleed. However, to reach this conclusion, all serious causes must first be ruled out. What should you do? If there is a lot of bleeding or the bleeding does not stop, call an ambulance immediately. If there is a small amount of blood and the cause is unknown, see a doctor without delay. Do not assume on your own that it is nothing serious. Final words. Coughing up blood is not a disease itself. It is a warning sign from your body. Sometimes it's minor, sometimes extremely serious. If you take it seriously in time, many major dangers can be avoided. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. Information has been collected from Mayo Clinic, Cleveland Clinic, NHS, and other reliable medical sources. If you find this video helpful, please subscribe and share, because good health begins with awareness.